Hello and welcome to this month's Support Coordinator webinar. I'm Claudette Baines, your host for today's session, proudly brought to you by Endeavour Foundation. This month, we're excited to delve into supporting participants to manage their NDIS funds with our guest speaker, Mary from Support Coordination Academy. As we gather online with attendees joining us from across Australia, I'd like to acknowledge the significance of the lands we all call home. If you'd like to honour the traditional custodians of the lands you're logging in from, please feel free to share their name in the chat. I'd like to begin by acknowledging the Turrbal people, traditional custodians of the land on which I am hosting from today. In the spirit of reconciliation, Endeavour Foundation acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Before we get started, a quick note on housekeeping. Your microphones and cameras will stay off, but we'd love for you to join the discussion in the chat. If you have any questions for Mary, please pop them in the Q&A section and we'll answer them after the presentation. You'll also find a link to our privacy policy in the chat. Please feel free to reach out if you have any questions about it. Now, before I introduce our speakers, I'd like to highlight our past webinar recordings. They're full of valuable insights, strategies, and practical tips. You can catch up anything on our YouTube channel. Just follow the link in the chat to start watching. Now, we have received several requests from attendees over the last couple of months asking to make these live sessions more accessible. Thank you so much for your feedback. And to help, we've added instructions on your screens for enabling live captions in Microsoft Teams. Let me walk you through it now. If you click the More button on your toolbar, then select Language and Speech, and then Live Captions. You'll now see captions in real time at the bottom of your screen. We'll pop the instructions into the chat as well in case you missed that. As mentioned earlier, during this webinar, we will delve into the topic of supporting participants to manage their NDIS funds. Our presenter today is Mary from Support Coordination Academy. Coming up, Mary will talk you through a support coordinator's role in building the capacity of a participant to implement and manage their NDIS plan, strategies to support a participant to manage the expenditure of their NDIS funds, and how to ensure a participant gets value from their NDIS funding. Before handing you over to Mary, it is my pleasure to introduce you to Shania Brennan. Shania is Endeavour Foundation's Business Improvement Specialist, leading a team of social workers and disability specialists who advocate for our clients. With qualifications in psychology, HR management, and social work, plus 8 years in the community sector, she's passionate about empowering people with choice and control. Over to you, Shania.
Thank you, Cece, and hello, everyone. I hope that you can hear me okay. As always, it is wonderful to be here with you all today. So as Cece mentioned, I work at Endeavour Foundation, leading teams that advocate for people with disabilities, both in the change of situation space and in the intake and inquiry space. So as you know, today we'll be discussing how we support participants to manage their NDIS plans. And I'm here to talk about how Endeavour Foundation supports participants in this space. So as you can see on the screen, I've broken this down into a few different points, and these are different ways that our teams support participants and their families to understand their plans. So starting with point 1, so on the top left of the screen there, the top left bubble. So we know that understanding NDIS plans can be confusing, it can be overwhelming, it can be frustrating. And so we acknowledge those challenges and we try to understand where the pain points are for participants and their families, and it helps guide us in navigating further conversations about the plan itself. The second point, when communicating with participants, we're breaking it down, we're giving time and options. So we're taking the time to understand the pain points and where in particular the gaps are in knowledge around the plan, It helps to further guide the conversation and ensure that we're helping people in enhancing their understanding and building that knowledge and confidence. In the third point, we are creating a platform for self-advocacy. So we are giving participants the tools they need to understand their plan and advocate for support that will assist in achieving their goals. As you can see, each of these points really builds off of each other. And so by giving people time, breaking things down, giving options, we're creating that platform for self-advocacy and supporting a participant in having a plan that meets their needs and helps in achieving their goals. Now, we know not all participants have support coordination funding in their budgets, so these points really are support that we're providing for people that don't yet have support coordination and the benefits that come with that, and all of you and the support that you provide to the people that you support. So we, yeah, and in the final point there, we're supporting people to have an understanding of their plans and providing options in how to gain support coordination funding amongst all of the other opportunities that the NDIS provides for people with disabilities. So ultimately, supporting people in understanding their plans, giving them options around managing their funds and also what other possibilities there are to explore. And, that might include requests to change their plans, to advocate for support coordination funding and those sorts of things. To really just sum up each of those points, I wanted to share an example with you of how we've supported a participant and his family to understand his plan and advocate for increased supports that better reflect his needs. So we had the parent of this participant that is already an Endeavour participant, supported by Endeavour, sorry. They came to us and they asked for some support in understanding his plan, as they were hoping to go for a change of situation to achieve some SIL funding for him. This participant doesn't yet have support coordination funding, so his parents were feeling really lost and confused about how to navigate the space, and they didn't have a lot of support. So one of the practitioners in my client advocacy team worked with this family to understand the situation, understand what their understanding of the plan was itself and what they were trying to achieve with their son. And then we, supported them through the process of a change of situation. And while we are still waiting for the outcome of that, the parents did give us some feedback around how supported they felt and how much they're more confident in understanding their son's plan. And yeah, that's just an example of how we've been able to support a participant and their family in navigating this space. And I know that that's all of the work that our wonderful support coordinators do as well. So I'm sure we can all agree that it is so important that participants feel supported and understand their plans. And so before I hand over to Mary, who's going to take us through the rest of our presentation today, I'd just like to quickly wrap up by saying that if you do have any participants that you're supporting who are looking for home, work or community supports, our Endeavour team are here to help explore how we can support your participant in achieving their goals. So if you would like us to get in touch, please feel free to complete the form that will be available in the chat box and we'll reach out. I'm now going to hand over to Mary, who's going to take us through the rest of today's discussion. Thank you so much, Mary.
Hi everyone, welcome to the webinar session. Okay, let's make a start. So today we're going to be focusing on, so we're going to be looking at the changes. So when we first looked at this topic, it was a topic that someone had actually requested that we focus on, supporting participants to manage their NDIS funding. And I suppose what we kind of thought was due to the recent changes to how funding is made available, we're actually going to focus on that within this session. So it's about how the funding is allocated on the participant's plan, how this impacts on the support coordinator role, strategies to managing the funding periods, and how a support coordinator can support a participant to build their capacity to understand and manage this new approach to funding availability. Okay, so let's get started. Something to just be aware of: when I refer to the word participant, I'm referring to their extended network as well. So it could be the participant themselves, it could be their nominee, it could be family members, it could be whoever really supports that person to be able to implement and manage their NDIS plan. Okay, so let's get started. Let's start with legislative changes. I say, so you probably already would have heard and experienced the changes in funding periods that the NDIS introduced on the 19th of May. So these were changes in relation to the changes to the NDIS legislation in relation to Section 33, and that kind of happened in October last year. I suppose we were told that these changes were coming. I suppose there just wasn't enough. There wasn't a lot of warning, I suppose, or preempting about these changes coming. So it was a bit of a surprise. You can find more information around these changes, especially the frequently asked changes, in relation to that link. So you can, I'm not sure whether you can click on that link or you can actually just copy that link and put it into Google. But it's a really good page to go and have some really good understanding about the impact of the changes around the legislation. So the changes in relation to funding periods only impact on NDIS participants who are receiving a new or reassessed plan, so a new plan or a new to the NDIS. So if someone has an existing plan, they won't be affected until it's updated. So it's something to be aware of. So the funding periods is a specific allocation of funding within a specific time frame. So what that means is, say you have, you're working with a participant and their plan is for 1 year, the NDIA might make an assessment that the support coordination funding will be allocated in 3 monthly intervals, each with a funding allocated evenly over those 3-month periods. So we're going to talk a bit more about how that funding can be allocated. So the NDIS advises that the intention of this change is to help participants to manage their funding better and to avoid overspending too early. So it's ensuring funding and supports are available throughout the whole length of their plan. And it's actually a recommendation that came out of the NDIS review. So funding periods won't reduce the total funding in the plan. So the total funding will stay the same. It's just the periods of the funding, so when the funding will be available and how much within each funding period. So the other thing is to understand too, is that if a participant doesn't use all their funds in one period, say a person has $3,000 within a support within the first 3-month period, and they only spent $2,500. Well, then that $500 will roll over to the next funding period. So unspent funds will carry forward into the next plan funded period, so the funding period, but it won't. Any unspent funds won't roll over to a next plan. So sometimes what we've seen currently is that if someone's plan continues to roll over, the funds roll over with the next plan. So that won't continue to happen. So when someone's got funding periods and they might roll over and they've still got funds left in that last funding period, just like with new plans, the funding will stop and then the new funding will start on the next plan. The NDIS have referred to like 3 monthly funding periods in their communications. However, we're starting to see a range of different funding period arrangements in relation to support coordination being allocated on a participant's NDIS plan. So some examples of these are, so like a 1-year plan with a 1-year funding period. So the funding goes across the whole 1 year. We've seen a 1-year plan with 3-month fundly instalments with equal allocations across each instalment. And we've also seen a 1-year plan with 3 monthly funding periods, but the first 50%, so it's front end loaded in the first 3 months, acknowledging that support coordinator often does most of their activities within that first 3 months, and then the balance is being spread across the last 3 months, the last 3 funding periods. So it's really important to kind of get your head around how this is going to work. The NDIS has also advised that supports like supported independent living will likely have monthly funding allocations, and it's to reduce the risks of funds running out. It also reflects the high cost support. So often what we're seeing is high cost supports like SIL or more monthly allocations. And then thinking about things like assistive technology, really they might have upfront payments, or everything might be allocated within the first funding period, or it might be across the whole plan. So participants can view their funding periods in the NDIS portal and the NDIS, their My NDIS app, and in their plans. And they'll be able to see how much they have in totals, how much is available now, how much they've used, and when their next funding period, funding allocation, will become available. So with participant consent, support coordinators and plan managers will also be able to have access to this information via the PACE provider portal. So I've received quite a few emails from support coordinators showing me the different types of allocations, and that's in relation to the software that they use, our software that they use. Okay, there's a lot more information around how this all works in the frequently asked questions. So if you haven't read anything or you want more information, you've got questions, go and have a look at the frequently asked questions. Okay, we'll keep moving. Let's have a look at the impact on support coordination. So the recent introduction of the funding periods by the NDIS will significantly impact on how support coordination services are delivered and managed. So in one way is the increased complexity in budget monitoring. So support coordinators will need to stay closely aligned with the funding periods assigned to each plan component. So they can be assigned across core, capacity building, and capital. So this means that it's not just monitoring the utilisation of a participant's NDIS total budget, but also keeping track of the availability of funds within each funding period for each support. So it adds another layer of complexity. So as well as managing and tracking support coordination service billing and invoicing to ensure they align with when the funds are accessible, support coordinators will also need to keep track of those 3 monthly instalments. So being aware of how much funding you have within each period and keeping track of that service billing as well as invoicing. So in relation to a participant's budget, but also in relation to managing your own support coordination budget. So there's also a shift in service planning and prioritisation. So with funding periods being introduced, support coordinators will need to basically be really aware of when they need to front load essential tasks if funding is allocated heavily in early periods, and adjust the pace and scheduling of a participant's supports based on upcoming releasing of funds. But also planning ahead to avoid service gaps if it looks like a participant will likely deplete their funding early within a specific period. Okay, communication and education. Support coordinators will need to provide more education to participants in their informal supports or their extended networks around how funding periods will work. So with service providers, thinking about service agreements, when you're setting up service agreements, a service provider might have a schedule of supports, but now they need to actually break down when those funding periods will be available. So being really clear, and especially with support coordination as well, when you're doing your service agreements and schedules of supports, breaking it down into the funding periods, but again, breaking it down to another level. It's also helping participants to understand what supports are possible at any given time and prepare and support them to plan for future supports and when those funds will be available. Supporting participants in viewing and interpreting that information as well through their My NDIS app or the portal. Helping participants to collaborate with plan managers and other providers. So support coordinators will now need to coordinate services within a tighter time frame. So there'll be a greater need to collaborate with plan managers to track expenditure in real time. So tracking within those funding periods as opposed to the life of the plan. So coordinating with providers will also require better timing, ensuring services align with funding availability to prevent cancellations or service gaps. Okay. The challenges that the support coordinations will face is managing funding across multiple periods adds a layer of administration responsibility and financial pressure for support coordination providers. So it's even more important now for support coordinators and support coordination providers to have automated management and tracking software that helps them to manage and track their support coordination hours. So there's also an increased financial pressure on support coordination providers as the current hourly rate doesn't include the increased administrative responsibilities of the role. So we know we're all waiting for the new price guide to drop to look at that increased pricing. So overall, while these changes aim to improve participant budgeting and reduce early overspending, they also place a greater onus on support coordinators to manage funds strategically, to support a participant to manage those funds strategically, increasing administrative oversight and maintaining more of a proactive communication with stakeholders. Okay. Let's have a look at support coordinator activities and thinking about some of the areas that will impact for support coordinators and some strategies to actually manage some of the challenges that we were just talking about. Okay. Let's have a look at education. So support coordinators will need to provide education around the responsibilities and activities that support coordinators complete within specific timeframes. So it's now going to be incredibly important for support coordination providers. So generally with support coordinators, we always educated people about our role. So what is our role, especially when you're talking to new providers who don't really understand support coordination, or you're talking to mainstream providers like health or education or child protection or whatever that might be, we're often having to educate people about, well, what is our role? What is the responsibilities of our role? Excuse me, how do I work with participants? Where are the boundaries of my role? What are the things that I do? What are the things that I don't do? So really educating them, because then that's the way that we can actually work collaboratively. So this is what I do. This is how I can support you within your role. You tell me how, what is your responsibility? How can we work together? So we often have those conversations all the time with our support coordinator, with our participant support network. So thinking about, we also now needing to take that to another level, so add a bit more level of complexity. So we're going to need to be really, really clear about how we do our role. So the most intensive phase that I find as part of the support coordination role typically occurs within the first 8 to 12 weeks of a participant's plan. So this includes when we first starting to work with a participant, or even after a plan review or a reassessment and a participant has a new plan. So during this period, support coordinators are heavily involved in that planning, documenting the support participants' needs, gathering evidence, requesting assessments, and also completing your NDIS implementation reports. So it's quite common for around, up to about a half of the support coordination budget to be used within this initial period. And it's because it's the most intensive, it's where we start assessing, gathering information, documenting, evidencing, planning, developing our action plans, any risk assessments, setting up our systems and processes for the rest of the time that we support participants. So to ensure the funding is aligned with service delivery, it's essential that support coordinators clearly outline the activities that they'll undertake and the estimated time required with the participants that they support. It's also vital that this information is included in all communication with the NDIA. So when you're doing your implementation reports, your progress reports, your changes of situations, so that the NDIA understands both the funding periods, the level and amount of support coordination funding required. So when you're doing your change of situations, really, or your reporting or your progress reporting and supporting a person through a review, communicating with the NDIA around the level of support coordination that's required, the amount of hours that are required in relation to the complexity and intensity of support that that person requires, but also when that funding needs to be available. Okay. Future planning. I find future planning, I find with support coordinators, a lot of support coordinators that I work with, they have so much on their plate and they're working with participants all the time that they're always focusing on the now, what needs to happen now. And I suppose that sometimes it's a bit hard to then go back when you're doing your reviews or your check-ins and go, right, okay, so what worked well, what didn't well, what can we do differently, but also thinking about what's coming up, what's next, and doing that future planning, looking into the future or being more proactive about planning ahead. Okay, so when supporting a participant to prepare for a review of the NDIS plan or an upcoming reassessment meeting with the NDIS, support coordinators will need to support a participant to think about the supports being requested and when the funding for each of those supports needs to be available. Again, adding that another level to it. Also forward planning around transition stages to prepare a participant for key changes in their lives. So thinking about the skills, the knowledge and confidence they will need to move into that next stage of their life. So thinking about transitioning from school. So if you're working with children who are, or teenagers who might be transitioning from school in 6 months or 12 months time, doing that forward planning about what's that going to look like? What's the evidence I need to gather now? What are the funding? When will the funding need to be available? What kind of supports will need to be available? Or they might be transitioning from home or to living in the from home to living in the community. They could be transitioning to new support arrangements, or also transitioning into employment opportunity. So again, it's not just about what kind of supports will be needed, why they will be needed, what outcomes might be achieved, but also when will that funding need to be available. Okay. Hopefully this is making sense. Okay, and then lastly, all making sense. That's great. Good hand, good fingers up. It really helps. Okay, thinking about crisis management. So a support coordinator will need to be more vigilant, I suppose, in being aware of the events that may indicate when a participant may go into crisis. So it's kind of thinking about understanding the participants that you work with, understanding the patterns of their behaviours or the patterns of events that happen in their lives, understanding the journey that they've come on. And so as you start to work with a participant, you start to see these patterns occurring, and it might be about withdrawing from service providers, going back and understanding why that's happening, but also just really acknowledging and being more vigilant, I suppose, and documenting and evidencing so you can kind of get to know that participant be a bit more and be a bit more proactive in relation to planning ahead for crisis, kind of what I'm talking about. So needing to document and monitor early signs of when a crisis might likely occur, and assisting a participant to be more proactive as a support coordinator, being more proactive and starting to put mitigations strategies in place. Again, planning ahead. So these could be in relation to changes in a participant's behaviours or moods. So if you're working with a participant, you might see a sudden withdrawal from services, or the changes in their behaviours. So their behaviours might become more aggressive. There might be agitation or emotional distress. So you might start to see some signs and changes in moods or behaviours. And so it's really about being more proactive and investigating why that's happening, putting those strategies in place and trying to be planning ahead around funds that are needed. Okay, it could be in relation to maybe a decline in daily functioning. So it could be some signs around someone might not be attending work or refusing to go to day programs, neglecting hygiene or medication routines. It could be a regression in their skills or an increased reliance on others to complete daily activities. So again, just thinking about what are the changes in this person's behaviours or their environment that might indicate that a crisis is coming, and trying to be a bit more proactive. They could be like environmental or situational stresses. So it could be someone might experience some trauma or some grief. It could be family breakdown, threat of eviction or of homelessness, maybe some reduction in the formal or key support or a withdrawal of service providers. And it's also around, in relation to crisis management, I suppose it's also about being a lot more proactive and planning ahead, having systems and structures in place to track those support coordination hours. So not leaving it until the last minute, not leaving it until you've only got 2 or 3 hours left, but really being more proactive and planning ahead. So really having some policies and procedures in place around what is the minimum amount of hours that I ever want in a participant's plan at a certain point in time. And so if you're chewing through those hours, you go, right, now is the time to actually notify the NDIS. Now is the time to put a change situation in, to gather that evidence, to actually request a variation for additional support coordination hours. Again, thinking about the level, the intensity, or how many hours are required and when the funding's required. So again, we're going to need to be more vigilant around that and have the good systems and processes in place. So in summary, there are an increased responsibilities for support coordinators around building the capacity of participants to understand how to manage the funding periods with the NDIS plan. But the overall activities currently completed by support coordinators won't change. It's more the level of complexity of those activities that we do. So we're just going to have to delve a bit deeper and be a lot more proactive. Okay. Right. Let's go and have a look at some questions, because I'm sure there'll be lots of questions. Okay. Where is it? Okay. So can I get you guys to take back the PowerPoint, because it's covered up my screen and I can't see. Here we go. That would be really good. Great, that's good. Okay, so I'm going to read the questions from the bottom. Is that right? I start from the
Yes, you start from the bottom, Mary. Yeah.
Yep, great, thank you. Okay, can't see the presentation. How do you fund your time without support coordination in plan? You don't. I'm not quite sure what your question is, Michaela. If you're working with a participant and if you're working with them and they don't have support coordination funding in their plan, then I would be very strongly supporting them to understand how to gather the evidence of why they need support coordination, and then going back to supporting them asking them to go back to the NDIS and request support coordination funding. That might be through the LIC. So support coordination funding is only allocated at the moment when someone has complex support needs. So you would be supporting them to understand, why do they need support coordination? What is it about the barriers that they face? Is it around someone who doesn't have a lot of informal supports to support them to manage and implement their plan? Is it about that they don't understand how to navigate those NDIS processes? Is it about they don't have really good communication or ability to communicate their needs? So understanding the barriers that a person is facing to be able to manage and implement their plan and participate in those NDIS processes. And those processes include linking to providers, researching providers, knowing what good providers are, setting up service agreement, all those beautiful things that support coordinators do. You would support a participant to understand what those barriers are and document those and go back to the NDIS and request support coordination. Okay, Claudia Kumar. Section 33. Okay. If the participant is unhappy with the plan and wanted to review, with getting a functional capacity assessment? How do we get it front loaded? Okay, sure. Okay. So Claudia, if you were working with a participant and I'm not sure, I haven't seen the plans in relation to therapy support. So you would need to have a look. You'd need to go and have a look at a participant's NDIS plan, have a look at the capacity building funding in relation to accessing a functional capacity assessment. I would assume the NDIS have said that they will be allocating funding periods, for capital capacity and core supports. Within those support categories, they'll be allocating them based on a participant's situation and needs. So when they go through that planning process, they'll be identifying the supports that they require and then looking at that participant's situation. So if they needed assistive technology, that would likely be uploaded up front. If they needed if someone was, say, requesting, if the person was new to the NDIS and the NDIS was requesting for the support coordinator to follow up on getting a functional capacity assessment, my assumption is that they would put that funding in the first 3-month period or whatever, or it might even sit right across the plan. So it's really thinking about looking at that plan, understanding when the funding is available on the next plan. So it won't affect the current plans. It's when the plan gets renewed. So as a support coordinator, you need to be really, really clear when you're supporting that person to go through that review process. If they're going for a reassessment, then supporting that person to understand what are their goals, what are the supports that they need from the NDIS to achieve those goals, what will those supports look like, but also when will the funding need to be available. So you need to be able to communicate that in your support coordinator reporting to the NDIS. Hopefully that helps. What about plan continuation? Funding period is applied to plan continuation. Michaela, I'm assuming you're talking about, so again, current plans won't make, nothing's changing until they get a new NDIS plan. My understanding is that there hasn't been a lot of clarification about plan rollovers. So the communication that I've seen kind of indicates that they won't have the plan rollovers or that they'll put new funding periods within the new plan rollers. I haven't seen a lot of communication about that. So that would be something to ask of the NDIS. I'm thinking when you're saying plan continuation that you mean plan rollovers, which means participant has a current plan. They just, because the NDIS have made an assessment that their supports are stable, they have just rolled that plan over and it just continues, with new plan periods. So I'm not sure about that. You'd need to check with the NDIA or their frequently asked questions. Okay, Evelyn, I have just completed a plan meeting and they told me that all new plans will be 5 years unless you have a generative condition, which the plan will be 2 years. Is this correct? Look, the recommendation by the NDIS review was that plans should be longer to give participants more stability in relation to the fund, that their supports will continue. That's where the 5-year recommendation came from. I haven't heard any confirmation. I've seen plans that are still 1 year. So, and these participants don't have a degenerative condition. So I think it's really just talking to if you're supporting someone in that review meeting, being really mindful of how long that plan should be for. If someone has a 1-year plan, generally what will happen is it's because their plans are less stable and they need to be reviewed within a shorter period. If someone has a 5-year plan, the idea is the recommendation was from the NDIS review to allocate 5-year plans and then only reassess those plans and so for that funding to be all of the funding to be allocated across those 5 years, but the funding will only be available within those funding periods per year. And so that's kind of what the recommendation will be. I think it's really just a wait and see. And it's really as support coordinators really talking to the NDIS around the level of stability of the supports that a person has and then recommending that length of plan as well. having that discussion during that plan meeting to confirm how long the plan will be allocated for. Okay. Now, Raoul, is this for ones that are on old plans now? If client got a letter to say it has been extended and any unspent funds will be added on top of the top up. Michaela. Oh, no, Raoul. Okay. Again, I'd need a bit more clarification. Sorry, I need a bit more information around that. If a participant gets a letter that says their plan is just going to continue, I'm assuming that that's just going to be what we call rolled over. It's going to be a continuation of the same plan with different plan dates. So it will just get renewed. Same plan, same funding, same support, same everything. It will just get rolled, same plan. Reassessment means so that's the same plan rolled over. I'm not sure about the allocation of funding periods on a rolled over plan. Again, go and look at the frequently asked questions. In relation, they're talking about new plans, and they're talking, so whether that means rollovers or not, I'm not sure. Again, look at the frequently asked questions. In relation to a reassessment, so a reassessment is when the NDIS actually has that review meeting. So a rollover, they don't have a meeting, they just roll it over. Plan just comes in. Whereas a reassessment is when participants' needs might have changed. And you, as a support coordinator, you might have done your review. So within the last 3 months of the plan, you would go and do that review with the participants saying, right, how was the plan? Did you achieve your goals? Did it work? Did it not work? What worked well? What do we need to change? You're doing that whole review process, thinking about the future goals, what supports are required. So you're doing that whole review process, doing your NDIS end of plan review or progress report, which would then get considered at that reassessment, all the evidence that you'd need for those new supports going forward. And then in that meeting, that's when you would be talking to the NDIS about what supports are required, the amount of supports that are required, outcomes to be achieved, but also the funding periods for all of those supports. Okay, is there a flow chart of structure and roles? I'm sorry, Polly, you would need to be a lot clearer around a flow chart of structure and roles for what, sorry? Okay. Does the new requirements reporting apply to self-management? Again, Polly, you'd need to be a bit clearer about those questions. Look, you can, if you want more clarity, you can email me at info@scacademy.com.au and I might be able to help you a bit more. Reporting as a support coordinator, if you're working with someone who is self-managed, plan managed, or agency managed, the reporting is still the same. What should we prioritise with so little SC funding available? If you're working with a participant that has minimal amount of funding, then you need to prioritise what needs to happen first. So you need to be working with a participant to do that really extensive planning and prioritising about what can be achieved with a minimal amount of funding available, and then really supporting a participant to gather evidence around why you need additional support coordination hours. Okay, Louise asks, can anyone suggest software CRM that will already efficiently track funding spend across multiple funding periods and category? Yes, so Support Coordination Academy partners with support coordination software. So you can go and Google support coordination software. And we are also just updating our functionality so that you can manage funding periods. Okay. Keep going. Yep. And the other one is support coordination software. Okay, new posts. Trying to find them. Okay. All right. Okay, got that. Michaela. Do we need to be registered to do support coordination? Fatima asks. At the moment, no, but mandatory registration is coming in support coordination. Okay. Do you think there is an increased need to prioritise which allied health professional is needed for the participant? Appears really tricky and problematic. Coral, you would need to give me more context around the situation. If I'm ever working with a participant and I want evidence around the allied health that a person requires, always go back and get a functional capacity assessment, because a functional capacity assessment will look at the goals of a person, their functional capacity, how that reduced functional capacity creates barriers, and what supports that person will need, including allied health support, to enable them to achieve their goals. Lena, some plans have support coordination, specialist support coordination. Would they need to be performed by different individuals? There's a lot of questions around basic support coordination. So if you're wanting to do support coordination or you don't understand support coordination and you want to get into the role, you need to go and do support coordinator training. They will answer all these questions for you. Support coordination and specialist support coordination, if they're both on the same plan, I always recommend that you have separate professionals doing the both roles, and that those professionals then work together. So specialist support coordinator focuses on specific activities, the level 2 support coordinator focuses on other, and they work together to collaborate and get very clear about who's responsible for what. They have a completely different focus. NDIS planner recently advised me that participants in group homes have 1-year plans. There you go. Just sharing for your information, I have a client with degenerative and terminal condition. The new plan is dated 19th of May and is 5 years. There you go. So again, not a lot of consistency around the way the plans have been allocated. Thanks for your speech, Marie. I'm Hannah, public health graduate from QT. I'd love to ask more about the course. Okay, please email me hoa at info@scacademy.com.au. Okay. Needing clarification on reviews. I've been told that they are limiting reassessment of reviews. Is that correct? Okay. The NDIS have a responsibility to offer a reassessment to a participant if they request it. Yeah. So if you're working with a support coordinator, if you're working with a participant and their needs have changed, or the goals have changed and their needs have changed and they need different supports, different levels of funding, then when you're reviewing that person's needs due to the end of their plans or within the last 3 months, you need to be supporting that participant to go to the NDIS and request a reassessment of their support needs, that they will request a reassessment and review by the NDIS, and to not roll over the NDIS plan. Okay. What happens when a participant exhausts their NDIS funding before the end of their funding period, for example, the first 3 months? No. So the whole idea of having funding periods is to support it. The idea behind it is to help a participant budget and manage their funds over the length of the period of their plan. So if it's for a year and the funding's available in 3 monthly periods, helping them to manage that funding within that funding period, so they don't use it all within the first month. So if a participant is using their funding within the first month, say they have, say you're a support coordinator and the participant has a minimal amount of funding, and then you start working with them and you go, wow, this person only has been allocated 20 hours of funding, but their support needs are really, really complex. There's high risk involved. I'm having to work with them really, really intensively. We're going to get through that 20 hours within the first 3 months, never mind the next allocation. So I would then be working with a participant to put in a change of situation and getting evidence around the complexity, the risk, the increased complexity, the barriers that they're facing, and making highlighting to the NDIS the urgency around getting additional supports. Okay. Where can you receive support coordinator formal training? From Support Coordination Academy. So go and have a look on our website or email me at info@scacademy and I can send you some information. As an RN, can I do sole trader support? Again, you need to do the support coordinator training, and that will talk to you a lot about how the environment that you work within. Any advice around SA? I'm thinking still providing an SA for the life of the plan and then breaking the funding periods into the schedule of support so I don't need to complete a service agreement. Okay. Again, really, really good question, Amy, and I'm glad you asked it. This will be my last one. So service agreements still sit across the period of the length of the plan. Yeah. So best practice, if you have a service agreements sit across the length of the plan, not within the funding period. So you have a service agreement. Say you have a service agreement for a participant has a plan for 2 years. Best practice is you renew that service agreement every year. However, that's best practice. So if you have a service agreement sitting across a participant's plan for 2 years, then your schedule of supports that needs to go with that service agreement needs to say, for this line item, for this service, for this line item, detailing how much funding that you need to have available, breaking that down into the hourly rate, how many hours does that equate to, but then also breaking that down into funding periods. Yeah. And then I would even be within your service agreement. You could even then talk about what I always suggest with service agreements, talking about the support coordinator role. So how do you actually perform your support coordinator role? What would happen within that first funding period? What would likely happen in the second? So thinking about your roles and your responsibilities. So the first end is assessing, gathering information, planning, putting action plans in place, identifying any risks, identifying priorities, thinking about how you communicate. So it's always good to have a one-pager that goes with your service agreement anyway. But again, service agreements generally sit across the length of the plan. Your schedule of supports needs to be broken down into funding periods. Hope that helps, Amy. Okay. Tight. Funding periods and NDIS plans are not new. Changes to the NDIS Act introduced funding periods in October 2024. Yes, all new and reassessed plans since then have included 12-month funding periods. Absolutely. So they've always been the funding periods. So since then, the NDIS has been allocating a lot of one-year plans, and the funding has been sitting across that one-year plan. What they're saying now is you might have a 2-year plan, which has 3 monthly funding periods across the whole 2-year plan. So they started really implementing more specific funding periods as opposed to 1 year across the plan since the 19th of May. Okay. Okay, I actually need to stop talking because we're going to run out of time. Okay. Vincy, can you just send me an email at info@scacademy and I'd be happy to help you with that and a client that you're working with. Okay, here we go. Great. I think I've got to the end. Look, thanks very much, everyone. If you have any inquiries about our support coordinator training, any inquiries around our support coordination software, feel free to email me at info@scacademy. Happy to provide you with lots and lots of information. There seems to be a lot of questions around that. Thank you very much, everyone. Look, I hope that was helpful. Lots of hands. Thank you very much. If you have any queries or you want me to follow up on something, please email us at info@scacademy. Thank you very much, and I will see you next time. Take care. Have a great day.
Thank you so much, Mary, for another informative and thought-provoking session. I'm sure it has sparked plenty of ideas and opened up new ways of thinking about support for your clients. As Shania mentioned earlier, if you have a client or clients who you believe would be a great fit for the services offered by Endeavour Foundation, we'd love to connect. Please complete the form available in the chat box, and Shania and her team will be in touch with you soon. Tomorrow, you'll get an email with a recording of today's session and a PDF of the presentation, so be sure to check your inbox tomorrow. We would also love to invite you to join us next month in July. Our next webinar, Service Agreements, Safeguarding a Participant's right to Choice and Control. It is on Tuesday, 15th of July at the same time from 12 p.m. to 1 p.m. Australian Eastern Standard Time. If you missed it earlier, we just shared the link again to our support coordinator webinar recordings on YouTube. Don't forget to subscribe so you'll know when new videos are uploaded and ready to be viewed. If you'd like to stay informed and support your clients even better, we also dropped the link to our fortnightly Care Connect newsletter in the chat. You can sign up for valuable updates, insights, and resources delivered straight to your inbox. On behalf of Endeavour Foundation, thank you for being part of today's webinar. Wishing you a fantastic afternoon, and we look forward to seeing you again next month. Thank you.